Coming out this morning to SUNY Downstate. Welcome to our campus. If this is the first time you're here, please welcome. We enjoy having you here. And for those who are here, thank you for being here and supporting us. This morning we're getting together to make a really very important announcement. I won't go into details. Obviously, you're probably familiar with what it is that we're going to be doing today. I do want to take a moment to say thank you all for being here. Thank you for your support and for participating in this very important matter for not just Downstate and for MIMO, but for the communities that we serve. Now, before we get started, may I ask you to please silence your phones? So what we're going to do, we're going to start with Dr. Riley. Dr. Riley will manage the whole process and call each speaker up. I'd like to ask Senator Myrie, Ms. Donnell, Dr. Becker, Dr. Salafu, who am I missing? Anybody that I'm missing from any place that I should know? Okay, great. If you can all stand right here, Dr. Riley will be in the middle, so we'd like to have you standing on either side of him. Mr. Daly, if you'll join as well, and Ms. Ringel. Did I get that right? Renee? Yes. We have a special visitor from American Cancer Society, who, of course, is a really great partner in the work that we're doing. So to have them as part of this announcement is very important for all of us, and we're very appreciative of them also. If you can all come in a little tighter, please, because, you know, we have to get the money shot. All right.
There we go.
Okay.
Great. We're ready? We're ready? Oh, one more picture first before. Okay. Go ahead, John. Well, good morning. Welcome to SUNY Downstate Health Sciences University. My name is Dr. Wayne Riley, and as I always say, I have the honor of a lifetime to serve as the president of this great institution that has served Brooklyn, New York City, the United States, and indeed the world. So today is a very special day because it is a inflection point, if you will, about our strong belief that the way, or one of the ways, to address health disparities and improve the health of all citizens of Brooklyn is to develop great partnerships and great educational programs to train physicians and other healthcare professionals to take care of the wonderful people of Brooklyn, and Central Brooklyn in particular. So this is a new initiative that is not so new in some respects because SUNY Downstate has been enormously benefited by a strong affiliation with Maimonides Medical Center, one of the premier private community teaching hospitals in all of New York City, again, here in Brooklyn. So I have enjoyed tremendously working with Ken Gibbs and his outstanding team to grow programs and new initiatives such as the one we're going to talk about today that improves the coordination and I would argue the ultimate quality and effectiveness of cancer care for Central Brooklyn. This new initiative builds on other initiatives that we've already embarked upon that have been widely successful. We have chairs, Dr. Danny Rosenbaum. Where's Danny? Danny, stand up. Our chair of neurology is not only the chair of neurology at Downstate, but also at Maimonides. And therefore, it makes, again, coordinating of neurological conditions and treatment of neurological conditions and the training of neurologists to take care of neurological conditions that much more effective. Next to her is Dr. Jenny Libyan, the chair of pathology. Dr. Libyan, Jenny. She is chair of pathology at Downstate and chair of pathology at Maimonides, an outstanding physician, and she runs a great pathology training program, again, that have benefited both of our great institutions. Let's see whether anybody else, we did at one point share OBGYN chairs, but that was a transitional period. Dr. Howard Minkoff was our chair of OBGYN before we were able to recruit Dr. Camille Clare. So again, you can see that we've been doing this for quite some time and that today is yet another manifestation of the great relationship we have with Maimonides. So with that, I'd like to call up in this order the first two speakers to give brief remarks. The first is an outstanding servant of Brooklyn and New York City, New York State, and that is the Reverend Dr. Kirkpatrick Kohal. Reverend Cole Hall is the pastor of Lenox Road Baptist Church, just about a block and a half from us. And he is also the chair of the Downstate University Council, which is a body appointed by the governor of New York to oversee and to guide the work of Downstate and our team and our faculty. So Reverend Cole Hall, we'll ask you to come up. And then after that, a great public servant that I've had the honor to get to know, and that is State Senator Zellner Myrie, a distinguished attorney, a passionate believer in social justice, a passionate believer in health equity, a passionate believer in institutions like our hospital, that the safety net hospitals of New York City and New York State. And I have had the honor of working with the Senator, and I just salute all the great work he does on behalf of his district and us at Downstate and Maimonides. So we'll ask those two, and then we'll then rotate some other speakers through after that. But Reverend Cole Hall and Senator Myrie, please step forward first.
Thank you, Dr. Riley, and good morning, everyone. Let me try it again. Good morning, everyone. Oh, all right. Let me just reintroduce myself. If you drive by Nostrand and Lenox Road, you'll see a church there that has been there for 150 years, and I am the senior pastor of that church. I wanna use this opportunity just to congratulate Dr. Riley and Mr. Ken Gibbs, CEO, and representatives from both Maimonides and Downstate University Hospital for the new partnership that is being created right here in central Brooklyn to address the many needed medical concerns of its constituents. As a pastor and religious leader in Brooklyn, I have often prayed and referred people to various doctors and health facilities to address their medical concerns. You and I know that a cancer diagnosis can create unnecessary fear, anxiety, and questions about finding the best treatment and supportive care. When one thinks of cancer treatment, the first thing that usually comes to mind, and to my mind, are the specialized hospitals in the city. However, many of our constituents do not have the resources or the ability to travel to obtain both inpatient and outpatient treatments. In fact, some might even believe that because of their race, ethnicity, or their socioeconomic status, that they will not have the kind of care and access that is needed. So this partnership and collaboration right here in central Brooklyn will create, I believe, additional access, not just for average medical care, but for the best medical care that one can obtain anywhere in the world. So again, I want to congratulate this partnership and celebrate the strengths that both institutions have in addressing these important and urgent medical needs for our community. Again, may God bless this effort. Thank you so much.
Good morning to everyone, and let me first start by congratulating Dr. Riley and Ken Gibbs on this partnership. This institution is personal for me. I have received health care here. In fact, when I had COVID-19 in a pretty bad way, I was at the ICU here at SUNY Downstate. When my grandfather was going through some health challenges, he was at Maimonides. And we are reflective of what this community is. Black and brown people, many of them immigrants, who rely on these institutions for their health care. And for too long, the state, the city, our government apparatus has ignored the needs of these institutions. And we don't get the same resources that institutions in other neighborhoods get. And so I am very proud to be standing here with all of you because this partnership is a signal of what is to come. We deserve the best healthcare service in our communities. And we particularly deserve that when those diagnoses are acute as it relates to cancer. So I want to congratulate you again. I am proud to be the representative of these institutions. And I want to shout out my colleagues in government who you will hear from but who have also joined in the fight for equity for safety net hospitals. Assemblymember Monique Chandler-Waterman, Assemblymember Walker, and we had Councilmember Narcisse with us earlier today. Without these individuals, we cannot bring the resources as well. So thank you again, and I look forward to supporting this in every way that we can.
Thank you, Senator. Thank you, Senator, for your great servant leadership of your district and, again, in Brooklyn. I'd like to call up, before we hear from a few other speakers, including the elected officials who are here, we want to make sure that we recognize their wonderful work as well. But the CEO of Maimonides Health, Mr. Ken Gibbs, has been a great partner, great friend, great leader of healthcare in Brooklyn. And Ken, I'd like you to say a few words and then introduce the distinguished board chair from Maimonides to follow you.
Thank you, Dr. Riley, and thank you for so pinpointing the importance of this event. And I really want to underline that. But first, I just want to say personally, the chance to build the relationship and your incredible leadership underline what brings us today and takes us forward. As Dr. Riley said, this is a time of incredible challenges in healthcare. And we are also at a time of great societal challenge for a variety of factors, but part of it has to do with having been through what we've been through with regard to the pandemic. And I think we are only now at an inflection point where we can really see the going forward. And in dealing with the challenges, as Dr. Riley underlined, it's partnership, which in essence is overcoming social distancing, which does not define what a human being is, social distancing. Partnership and social connection and community define a human being. What's happening here today is an incredibly powerful partnership, and it combines notions that both institutions work together on the concepts of education and clinical excellence. Both institutions have a power and commitment to that in this borough like no other institutions. And being able to learn and teach is a critical component of driving clinical excellence. And we are institutions that have stood for those values and stood for those values here in Brooklyn. And there is appropriately a thing such as Brooklyn Pride, because it runs the full gamut from the diversity, which is frankly what does make America great, to a level of character and intelligence that drives excellence. And SUNY Downstate has been a beacon for spanning that, and we are incredibly grateful to partner in doing that. And this work has taken far too long, but there's a reason for it, and that is building relationships are hard. Mutual respect is important, and communication is important, and the world deals challenges. And it's the strength of connection that enables there to be success. And healthcare is littered with good ideas and rational strategies that broke because there were not the relationships. And here we are in a community, SUNY Downstate is inside a community with a beautiful and powerful culture that has not had access to enough in any fair way. And we are here to have a relationship that is going to close that gap. And we are only going to succeed because of the power of the relationships and what is evidenced here in the room, which is that there are clinical teams from different institutions who have worked together. There's leadership that's worked together, but there is also community leadership and political leadership. And we need to be a society that respects and is effective in the full gamut of driving the communication and effectiveness from the talent in the field to the communities who need the service up and effectively in the political domain. And this event is going to bring care to people who haven't had access to it. And that's physically the actual clinical work, but it's also the cultural welcoming. And SUNY has been excellent in that, and they are a critical partner for that. And those who don't know us that well should know that we deal with 80 languages. We deal with an incredibly broad group of communities. We have people on stretchers who come from countries where they're killing each other, and they're lying on stretchers next to each other, being treated by clinicians who come from comparable countries. So we are committed to that, and we are going to do this together. But I also want to take the pledge on the going forward, short run and long run. Short run, I know I shouldn't go here, but we just got a state budget, and what happens between now and the finish line really matters. Right. And just being very practical, the first year of this administration was running for election. This is the year when you have 4 years till you run again. This is the year when you got to get it done. This is the year when hard decisions have to be made. And the time is now. And I can only say I am unbelievably grateful to the partners up here and the leadership up here for their commitment to these issues and this effort. The other thing I want to say is that there's a pipeline behind this. And groundwork has already been laid. And that really is thanks to the leadership at SUNY Downstate. And just like you talked about the honor and the privilege of standing in your seat, I'm unbelievably grateful to be able to stand in this seat, but also be part of this vision with Downstate. Thank you.
Thank you.
I can't just leave? Come on, everybody. Our chairman, Gene Kalin, I was going through with somebody his resume. I'll just say that he's been an unbelievable first citizen of this city and of our communities, always finding a way to be part of the real world and practical financial issues with a focus on mission. And then as a chair through incredibly challenging times, he has had the right measure of wisdom and support. And yes, as a CEO, I'm grateful that we don't get what I like to call stray voltage. Anyway, thank you, Gene.
Chairman.
Thank you. It's hard to add to what Ken said. It's certainly hard to increase it, but I want to underline a couple of parts of it. First of all, for those of you who know Ken, he's a very mild-mannered guy. The substance of what he said is something we all agree on, but the passion that you heard about the mission, about equity, about justice, about the really urgent needs of our time to address these issues and find a real solution to them. That's also who he is, and that is one reason we know that it's matched by an equal commitment on the part of the Downstate leadership. That's why these two great institutions, which for most of their history have moved along in parallel, are now moving closer and closer together. Our mission, as you know, and as Ken said, is to provide the highest level and the highest quality of care to communities in Brooklyn that otherwise would not have it available to them, so that patients can get the care in Brooklyn, stay close to their home, close to their families, close to their communities. We believe it's better for medical care. We know it's better for the patient and their families. Pick up on one point that the senator made. I was thinking on the way over here that there are a lot of people who view big hospitals like ours as dinosaurs in a way. Yes, they dominated the landscape, but now they're lumbering, they're hungry, and they're about to be passed by the force of evolution. Last 3 years teach us, if nothing else, it's not the case. That when you need hospitals, when you need the complex of skill and logistics and all the other elements that we have to bring together every day, you absolutely need them, and you need them to be at the highest level possible, and you need them to be available literally on a moment's notice. And as Dr. Riley mentioned, the questions of equity and justice are absolutely central to that. We appreciate the support of the elected officials who are here. As Ken said, we're going to appreciate their support in the hand-to-hand struggles over the budget. We want to thank you all for being here, and we look forward, as Ken said, not just to carrying out the current expansion, but to what lies ahead of us in the future. Thank you.
Thank you, Chairman. Thank you, Chairman. And before we hear from our clinical and operational leaders who will make this partnership work, there's some additional honorable members of the New York State Assembly that I'll call up in this order. Assembly Member Walker, Assembly Member Cunningham, and Assembly Member Chandler Waterman. So please, distinguished members of the Assembly, please come forward and share with us your remarks and your concerns, your pride, and what we're trying to do here in Brooklyn.
Awesome.
Yep.
Thank you. Thank you, President Riley. Assemblywoman Chandler Waterman said, Latrice, why are you still wearing your mask? I'm like, because all these healthcare providers are wearing theirs. And I take my cues from the experts. So thank you, President Riley. And, of course, thank you to my colleagues in government and to all of the leadership who we've heard from. I guess it's also fitting to say that behind every strong man, there's a stronger woman. And so it's befitting, of course, to be supportive of Downstate. Being here at this hospital, just as the senator mentioned, healthcare in our community is real for us because we're Brooklynites. And when we have to get our healthcare, we don't necessarily have the luxuries of going to many of the hospitals, whether they be in Manhattan or otherwise. If an ambulance comes to pick us up, we don't have choices in terms of where they're going, and they definitely won't take us to some of the big names. So we're coming to SUNY Downstate. I do join and say that I got some very, very quality health care here in some very extreme moments. And I was glad that my zip code did not determine the quality of the care that I received, whether it is from a structural, equipment-based level of care, or quite frankly, from the care, the love, and the attention that I received, of course, from the administration, nurses, doctors, et cetera. And so I want to thank you. I want to say thank you to our president, Dr. Riley, and of course, Ken Gibbs at Maimonides. I don't know, Maimonides is like the godparent of healthcare in Brooklyn. Whenever it is that there are hospitals from Brookdale to Interfaith and anywhere else within our Brooklyn healthcare network, we can always count on the leadership of Maimonides to help see us through many of the circumstances that we are facing. And so, of course, for oncology and hematology, we know that, the diagnosis is always very late. And by the time many of us present for care, when it comes to cancer, it is sometimes too late. And now we know that through this very important collaboration, that void will be filled here in Central Brooklyn, and particularly to very underserved communities. And so we are excited about high-quality cancer care here within our community. whether it is from the diagnosis to treatment. And we're excited to make sure that cancer care is not delayed or inaccessible, and that our chances of survival are significantly increased due to this partnership today. Quality health care is a basic human right, and we are excited about the fact that we are celebrating its delivery here in our community. So I'm not sure. I did hear that we have a certain level of fights that we are presented with. Many of those fights I'm learning about as I'm standing here listening to the leadership speak. But anyone who knows me knows that I show up right for the fight. And I do not back down, particularly when it comes to making sure that all of our communities are receiving our just desserts. We are Brooklynites. We support SUNY Downstate, and anything it is that we can do in order to support, to continue to make the healthcare the best, the boldest, and the brightest that Brooklyn has to offer. We stand in the gap. Thank you very much, and I appreciate it.
Good morning, everyone. I'm New York State Assemblywoman Monique Chandler Waterman, covering in District 58, which is not this district. That's Brian Cunningham's, my colleague and my brother right over here. But we know I cover East Flatbush, Canarsie, Brownsville, and Crown Heights, but there's no hospital there. So where do our 90% of our Black and Brown Caribbean immigrants come? They come to Downstate, go across the street. So I am here today to speak on their behalf and to thank you so much for your leadership here. SUNY Downstate, thank you, Dr. Riley. Thank you, Maimonides Hospital, for a critical project in our borough. The healthcare needs of Brooklyn residents are vast, and this project that will bring advanced cancer care to Brooklyn is reassuring. I'm happy we can rely on medical institutions we know to provide service to meet our needs, especially Black History Month, when we know there's a lot of disparities when it comes to healthcare historically in our Black and Brown communities. So we are looking for any way we could go to the path to make sure there's equity when it comes to healthcare. And as my colleague said, I had my first child here, who's 21 years old, at Downstate Hospital. I refuse to have to go outside my neighborhood to go and get quality care. Whatever we need to tweak and whatever we need to improve, I believe we need to fight and make sure we do it together. So this disease and doing preventative care for cancer patients personal to me. I was fortunate a couple of years ago to have my sister survive breast cancer. And I was also very fortunate to have my father-in-law survive prostate cancer. However, 6 months ago, I lost my father to cancer. And this story is not unique just to my family. So when we talk about concerns and issues and equity and funding and resources, we are talking about our families as well. Cancer is impacting people at younger ages, and types of cancers are becoming more complex. And our reality is the healthcare system has to brace for what is projected to be 50% increase in cancer rates by the year 2050. I'm thankful that this collaboration meets a need and prepares for the future. Again, thank you to the leadership here. Thank you to all of you. Thank you so much.
Thank you, Anna. Thank you.
Is there a doctor in the house? A great senator from Brooklyn once said that everyone has said everything that's been said, needs to be said, but everyone has not said it. Senator Myrie, I am here to say what I need to say. No, but I walked here from my home, which is around the corner, 2 blocks away, and it's so comforting to know that in this community that my mother migrated to in the 1970s, had 2 hospitals, a train station and a church, and my pastor is here as well. But we know prayer without works is dead. And what's important is research and making sure that we offset, making sure that young people and people don't die of cancer. Every male in my family has passed away from cancer. Every male. My father is his last surviving brother of many of his brothers. He had 8 brothers, and everyone died. We know that access to care is important, but research and early detection is even more important. So it's so exciting to see so many elected officials, community leaders who are here to be in partnership with this hospital and with Maimonides. Thank you so much, and I will pass on. Thank you.
Thank you, Albert. Thank you. Again, we are so appreciative of the elected officials who've who've joined us today. Yes, sir, you do. We have extras, Assembly Member. But we're so appreciative of the support of the Brooklyn Assembly and Senatorial delegation. And Councilmember Narcisse was here. She had to depart, but she's coming back tomorrow, spend an hour or so with us. So that's the way we want to make sure that we highlight the great work that great institutions in Brooklyn like Downstate and Maimonides are undertaking to improve health care in Brooklyn. So thank you, members, honorables, for all you do. Let's give them a round of applause. I also note there's some staff members from Senator Prasad's office. She was not able to make it herself, but the staff members were here. But any staff members from any of the elected officials, please wave your hand. Thank you for being here. Thank you. And now I would like you to hear from the people who will make this program work, and that is the clinical and medical leadership of both of our institutions. And first we'll call up Dr. Moro Salafu, who is our professor and chair of the Department of Internal Medicine at Downstate. And he's been serving as the acting head of Hematology-Oncology. So I know he's probably the happiest person in the room. That he will then introduce Dr. Kevin Becker, who is the chief of the Division of Hematology and Medical Oncology at Maimonides, and who will also become the new chief of oncology and hematology here at the College of Medicine of SUNY Downstate Health Sciences University. So, doctors.
Good morning to all of you.
Good morning.
Thank you, Dr. Riley, for the leadership. Thank you, Mr. Ken Gibbs, for the leadership in making this happen. The vision was really outstanding. I'd like to also thank hospital CEO, Dr. David Berger, for bringing that to my attention, and to Laurie Donnell, who also helped in the strategy meetings to make this happen. I will start with a partial quote from Einstein. By the way, before I do my quote, thanks to the elected officials, we really need you. All right, so there's a partial quote from Einstein. It says that if you keep doing the same thing over and over again and expect the same results, you're not going to get it. So that is the situation in the Brooklyn 15 hospitals. We are all struggling from the same financial constraints. Elected officials are trying to help us to solve those issues. Government knows about them. The health equity issues are very obvious to everyone, and a lot has been said about that. But it means that the healthcare system has to change. We have to have models that are different from what we're doing right now. So having the Downstate model behave the same way it was behaving a year ago or several years ago is not going to help anybody. It's not going to serve the population that we truly love and want to serve. So this partnership is breaking that foundation. It's breaking that foundation and setting a new model where we are actually collaborating and partnering using the various strengths that we have. The strength from Downstate goes to Maimo. The strength from Maimonides Hospital comes to Downstate. The patient is well served, and we have a nice day. That is the goal. Now, the partnership also allows us to align a lot of things. We're going to align the manpower because no one hospital can, in today's healthcare environment, no one hospital is able to recruit the type of expertise they need in order to run their systems. It's really, really very hard. The only way we can do this effectively is when we come together and align manpower, the expertise that is required to solve a particular problem. This partnership will achieve that. The second thing is that we're going to align services. There are some things we do very well at Downstate in cancer services. There are some things that are done very well at Maimonides Hospital in cancer services, right? When we join the forces and we create protocols that allow patients to navigate the system and benefit from both the two systems, we are going to benefit the most, and then the patient will benefit the most from the care. The third thing is the discovery piece of it. We want to be able to keep the patients in Brooklyn, let them stay in Brooklyn, let patients get care in Brooklyn. The only reason they are going to Manhattan and other places is because we are not doing enough research to be able to find enough cures to treat the patient locally in Brooklyn. That is the reason. This partnership and collaboration would put the pieces together, the manpower pieces together, the services alignment pieces together, and put a little bit of cream on the cake, which is the research, to make sure that we are actually taking care of the population in terms of their needs. For instance, all of you know about sickle cell disease. That's one of the prevalent problems in our community. Some patients with sickle cell disease can get a bone marrow transplant, and they could actually potentially be cured from bone marrow transplant. Right now, we're not doing that. This collaboration should be looking at that very seriously, and hopefully we can achieve a bone marrow transplant for a sickle cell patient in the future at Downstate, and other cellular therapies at Downstate and Maimonides Hospital moving forward. The scientific contributions of the Division of Hematology-Oncology have been outstanding. I was an intern resident here in the early 1990s. I just stayed because I just love the institution, the mission it serves. The division was really, really one of the best divisions in the city of New York. It had a bone marrow transplant program that was there since the 1980s all the way to the mid-2000s. It did all the cellular therapies, all the solid oncologic tumors, all the hematologic malignancies. It was just a phenomenal program. And the research, one of them leading to the discovery of receptors on folic acid, that became a world phenomenon. Now there's a diagnostic test that you can use to determine the folic acid deficiency, and that came from Downstate in Hematology-Oncology division. So there is some very good things that happened to the division, and I'm just looking forward to Dr. Becker taking that mantle and moving to the next level, of course, with the help of myself and our dean, Dr. Brunicadi. I'm excited that he's actually going to be the chief of the division because I've had several interactions with him. I can see that he's also very excited. He has a big portfolio at Maimonides Hospital, I know that, but his ideas are just unbelievable, and I think he'll be able to handle the two systems very, very nicely. Lastly, I would like to thank my dean, who is always on my side, and we're always talking about how to change the system. Dr. Brunicadi, I really want to thank you. Yeah, I mean, it's amazing when you have a chair of a clinical department, you have a dean that is so supportive, and then will call you and say, oh, Moro, this is so nice, let's do it. It's just amazing. And then you begin to form relationships, and the relationships is what actually takes us to the next level, and the commitment to make those relationships actually come true. Lastly, Ms. Donnell, Laura Donnell, she's the CEO of our faculty practice plan. This agreement wouldn't have been possible without her involvement and strategy towards making things happen. And then Delphine Mendez, she's our Chief Strategy Officer. I really want to thank you so much. Could you stand and be recognized? She's our Chief Strategy Officer. Her head is all about strategy and making things work. So it's always nice to have a connection with her in terms of this conversation. So, well, again, thank you for your vision. Yep. And then I would like to introduce Dr. Becker, who is the chief of the Hematology-Oncology division at Maimonides Hospital. He's going to serve as a regional chief of oncology, and then we'll have two site directors to manage the programs. So, Dr. Becker.
Thank you, Mauro. Thank you, Dr. Salafu. It's an honor to be here today as we announce the beginning of a powerful collaboration in addressing the burden of cancer in Brooklyn. For the past 13 years, I've been proud to be part of the largest and most talented group of cancer physicians in Brooklyn at the Maimonides Cancer Center. It's a team that understands the unique challenges and barriers to care our community has faced and has succeeded in bringing the most advanced cancer treatments, including robotic surgery, stereotactic radiotherapy, and therapeutic clinical trials to the people of Brooklyn where they live. I'm excited that we will now be joining the long and distinguished history of SUNY Downstate in training the physicians and healthcare leaders of the future while addressing the barriers and healthcare disparities facing this community. I'm grateful to Dr. Riley and Ken Gibbs for the vision that made this partnership possible, as well as to Dr. Berger, Dr. Brunicadi, Dr. Cohen, Dr. Salafu, and Delphine Mendez de Leon for the support and effort that have made this possible. It's an exciting time to be involved in cancer care. We have more tools than ever for early detection, prevention, and to help people diagnosed with cancer go back to leading normal lives. This is truly a step forward in the important work of bringing the highest quality cancer care to the people of Brooklyn in Brooklyn. Thank you.
Thanks, Dr. Becker. Congratulations. You can tell by the passion of our two clinical leads that this is going to be a very impactful program for the patients of Central Brooklyn. I'm blessed to work with a talented group of administrators here at Downstate, and I want to call Dr. David Berger and Ms. Lori Donnell up after. Dr. Berger is a Downstate graduate who trained here in surgery and then returned about 3 years ago at my request to take over the operations of our university hospital at Downstate. He's an outstanding clinician, outstanding administrator, and has worked very hard to get to today. And after Dr. Berger, will bring forth Lori Donnell, who is our Vice President for Health Affairs and Executive Director of the University Physicians of Brooklyn. That's our faculty group practice. That is, Lori's work has been so instrumental in getting to today as well. So, Dr. Berger and Ms. Donnell.
It's still morning? Nope, it's afternoon. Oh, good afternoon, everybody. This is really an exciting day for me and the culmination of a lot of hard work by a lot of people. First, I'd like to thank our community leaders as well as our elected representatives for their support of Downstate and of this partnership. So thank you for being here today, and thank you for your leadership and your support. First of all, I'd like to thank Dr. Riley and Mr. Gibbs for their leadership and vision in getting our two institutions to work together to better serve our communities. I'd also like to thank Dr. Salafu and Dr. Becker for doing the hard work of merging the faculties and building the clinical programs and to be able to go forward with our vision of a unified and joint program. I'd like to also recognize my partner in crime, Lori Donnell, the Executive Director of UPB, and as mentioned, my Chief Strategy Officer, Delphine Mendez de Leon, and the Chief Operating Officer at the hospital, Pat Winston, for their hard work in getting this agreement done and getting us to this day. And finally, I also would like to recognize my partner and thank my partner on the academic side, the Dean of the College of Medicine, Dr. Charles Bernacardi, for his continued support in helping us to build and grow high-quality clinical, research, and educational programs. So thanks, Chuck, for that. For those of you who don't know, I am a surgical oncologist by training, and as a surgical oncologist and a hospital leader, I am passionate about the delivery of coordinated, multidisciplinary cancer care. By uniting the expertise of these two institutions, we can now provide state-of-the-art prevention, diagnosis, and treatment for all types of cancer. This is critical as we strive to eliminate the disparities in cancer mortality seen in our communities. Furthermore, by capitalizing on the research and educational programs at Downstate, we continue to advance the field of cancer treatment while training the next generation of cancer providers. As we all know, this is Black History Month, and I'm going to paraphrase Dr. Martin Luther King Jr. I too have a dream. My dream is that this is just the beginning, but that 3 years from now, we will be back here celebrating that we have addressed the issue of equity in cancer care in Brooklyn. We will be celebrating the fact that we have state-of-the-art prevention programs. We are detecting cancer at an early stage, and we have the best outcomes in the nation. So thank you for being here today. Thank you all for support and participating, and thank you, Ken Gibbs and Dr. Riley, for your vision and your leadership.
Thank you, David.
Good afternoon. On behalf of University Physicians of Brooklyn, and I want to acknowledge the faculty practice plan, I want to acknowledge many of the clinical leadership are here today. If you can just wave your hand. As we talk about, just wave your hand, Dr. Reed, because I can call you out, I can see you. Don't be bashful. And I do that in the sense that as we talk about University Physicians of Brooklyn and answering the call, when things come up in collaboration in larger rooms with leadership, there's a call. Usually starts with Dr. Berger, as he calls me, his partner in crime, or Delphine, saying, Lori, we need you to take this message and we need to do this. I want everyone in this room to know and understand that each and every time a call like this is brought to any of our clinical leadership, they are on board. They are dedicated to providing quality patient care in this community. Dr. Berger, Mr. Gibbs, you don't have to call me anymore and say, where is this? It's done. I am the paper pusher. Delphine, this is done. You know, the good news about these kind of partnerships, once something large like this has been done, we can continue to move, and I know Delphine's bells are probably going off on what we can do next. We can have many more partnerships like these. And as Dr. Salafu pointed out, maybe, you know, taking a look at sickle cell disease in this community may be our next partnership. It is something that we see a lot in our quality initiatives. So thank you. Thank you, Mr. Gibbs, for this initiative and many others that we've done with your collaboration. We appreciate it, and thank you all for coming out today. And thank you, Dr. Riley.
Thank you, Lori. So before we conclude, there's a few community leaders. I'd like them to wave their hands. They don't have to speak. We're not going to put you on the spot. But we have an additional member of our Downstate Council, Ms. Marlene D. Heath. Marlene, wave your hand. Welcome back. Good to see you. Thank you for your service to Downstate as a member of the council. We had Judah Wolgenlercher, did I pronounce that right? Chief of Staff for Assemblymember Simcha Felder. Joe Fideli, is Joe still? There's Joe. Joe with Office of State Senator Roxanne Prasad, thank you. Give our best to the senator. Giovanni Picant, Giovanni's here? No? Oh, she's not. Renee Regnier from the American Cancer Society, a critical, oh, there you are, Renee. Oh, thank you so much. American Cancer Society is very integral to coordinating cancer discussions and care around the country, particularly here in New York City. So thank you for the great work of the American Cancer Society. And we have two members of community boards because we're very focused here at Downstate and at Maimonides on connecting to the community leadership. And we have two outstanding community board chairs, Fred Baptiste. Oh, he's not here? And Roderick Daly. Roderick, you want to say a few words? Looks like you're not bashful.
Well, I'm actually extremely bashful. But you know, the reason why I decided to say a few things is I'm actually a cancer person, right? I actually have stage 4 pancreatic cancer, and and that's one of the reasons why I want to take a moment to speak from the testimonial component of why this partnership and bringing something like this to my community is necessary. So, yes, I am the Community Board 17 chairperson, but I'm also I don't know if I should use the word cancer survivor, but I'm surviving cancer is what I should actually say. So, 38 months coming Saturday, I was diagnosed with pancreatic cancer. And all you doctors in oncology know that having pancreatic cancer, they gave me 6 months. It was important for me to have had the opportunity to get necessary services within my community. That didn't happen. So I had to go outside. I flew to Atlanta. I flew to all these different places. When a partnership like this would have been something that we needed within our own Caribbean community. A couple of us talk about the Caribbean community, but I live it, right? We don't talk about anything. We hide everything. We don't want anybody. So now I talk about it. So this partnership will allow for easier access. But I don't just want the institution just to be here, but I also want the institution to go out and get the message out. Because just alone being here is not going to solve all of, well, we're never going to solve all of the problem, but it's not going to solve the majority of what it is that we are hoping to accomplish. So our Community Board 17, my chair of social services, Rhonda Joseph, and all of my first vice chair as well, we are more than willing to partner with you here to ensure that the message gets out to our community. I know that personally working with both Assemblymember Brian Cunningham and Assemblymember Monique, I don't know why I'm calling her Rodney's. I do know, I know, trust me, she went to the same school I did. We fight all the time, you know. But, and also the other leaders, we care. We care about what happens within our community. We care about, from our Caribbean background, what is happening. So before I step down, I just want to say, it's not just the talk about the importance of what it is. It is living the importance of what it is. So I welcome this partnership with Maimonides, SUNY Downstate. I welcome the partnership with our leaders in government, Senator Myrie, and everyone else that spoke. And I welcome you to this community to do what needs to get done. But my only concern, I want to make sure I'm standing here as the president of the board to say, make sure that we reach out to the community, get the message out, not just talk from here, but talk from out there as well. So people like me, who when they say 6 months, at least I had 38. So thank you, everyone.
Ladies and gentlemen, there's no more to be said. Mr. Daly, thank you for your personal testimony and sharing your cancer journey. And that's why this partnership is so critical. As Mr. Daly said, we've got to get out there and make this real for people and that connect. So on behalf of all of us at Maimonides and Downstate, thank you so much for being here. Have a good rest of your day. Stay healthy and stay committed and engaged in all the great work we do to address healthcare disparities. Thank you so much. Good event, sir. Good event.
Can we all get together? Can we all get together for a group picture? Can we all get everyone
picture.
together for a group shot?